pleasure is to invite for the stage the head on infertility unit and the Op and Gyn Emergency Department of Policlinico of Milan, Associated Professor of the University of Milan, Edgardo Somigliana. Thank you very much.
Thank you for the introduction and thank you for the invitation. So the topic has been already touched in part by previous presentations, but I will try to answer this question. That is to say, does adenomyosis really affect IVF success? So I have some disclosures, mainly with the industries of gonadotropins. I had received some honoraria for lectures, and I'm also handling some grants of research. Considering other disclosures, I'm engaged in ART, so I tend to be biased in favor of ART. Half of my revenue comes from private practice, and I'm editor-in-chief of Human Reproduction Open. So is there a rationale to hypothesize a detrimental effect of adenomyosis? Yes, absolutely. Because adenomyosis is associated with inflammation and a network of inflammatory molecules that can somehow alter the endometrial cavity and the myometrium. It is also associated with uterine dysperostasis, and we know that these contractions of the uterus may be important for the implantation. So for sure there is a rationale to imagine a detrimental effect. But can we study receptivity nowadays? Well, in fact, as Paola Vigano mentioned this morning, it's something that is very difficult. And up to now, we had only one test that was used, but unfortunately not well validated in clinical practice. That was the endometrial receptivity testing. But finally, these pivotal randomized control trials last year say to us that it is useless. So we do not have a test to study receptivity. And therefore, we have to rely on the evidence, on clinical evidence. Therefore, on studies comparing IVF success in women with and without adenomyosis. And do we have a study? Yes, we have. We have a series of studies. We have also a meta-analysis that showed a strong reduction in live birth rate in women with adenomyosis. However, according to me, meta-analyses are not informative. They are not informative. Why? Because they tend to group studies that are different. And there are two main points to consider. First, as repeatedly underlined, adenomyosis is extremely heterogeneous. So we don't know what they are studying. We group all together in the meta-analysis, but we don't know what we are really seeing. But most importantly, adenomyosis is associated with endometriosis. It's associated with aging. It is also associated with parity. So, these biases are very, very strong. So we have to be very, very careful in grouping together everything. Endometriosis in particular for women who are operated for ovarian endometriomas, they have a reduction in ovarian reserve, a reduction in the number of oocytes, a reduction in IVF success, but maybe in adenomyosis has nothing to do. It is just because it is associated with endometriosis. So in fact, we have to be very, very careful to confound us. And according to me, there are two studies in the literature really informing about the effect of adenomyosis. The first one is that American study. It uses the PGTA model. I do not like PGTA. I think it should not be used. But for studies, it is very interesting because it is a model that can be informative. So in that study, it was prospective. They evaluate the presence of adenomyosis with Musa criteria, only frozen cycles, and they did a multivariate analysis to control for confounders. And what are the results? Here I highlighted in red the direct sign of adenomyosis, in blue the indirect sign of adenomyosis, no effect. And if I have any marker, no effect. Odds ratio of live birth, 1.0. The second study that I like has been already presented rapidly by Katerina Xakoustos. It is on the oocyte donation model, another excellent model. It is even better than the PGTR model because maybe with PGTR we are selecting most powerful embryos, and we may discard embryos that are less effective. Regardless, in contrast with oocyte donation, we can recruit all type of embryos, and therefore we may evaluate also sub-receptivity. So it is a prospective study, 114 women with adenomyosis, 114 controls, transfer of embryos from oocyte donation. Again, multivariate analysis. I looked at the results. Well, I was surprised in this study because the primary aim was implantation rate. And this is strange because for us, for those engaged in IVF, it's live birth rate, the main outcome. But in both, no result, no difference. Implantation rate was similar, live birth rate was similar. However, in a secondary analysis, that by definition is an exploratory analysis, so there is the need to confirm this, the authors looked to the miscarriage rate and showed a statistically significant increase in miscarriage rate in women with adenomyosis. And they also did subgroup analysis according to the form of the adenomyosis, and very interesting, they observed that this increased risk may be observed only when you have adenomyosis in the inner myomajor or when you have a severe adenomyosis with a score from Lazzari and Hexacostos above 7. So it is an exploratory, but it can tell us that probably we are wrong in focusing exclusively on receptivity. We may have to go beyond that, and in particular to pregnancy. I'm sorry, I don't like meta-analysis, but this is meta-analysis showing the association of adenomyosis with several obstetrics complications in general with a great obstetrics syndrome. That is to say, there is an association with preterm birth, odds ratio 2.6, preeclampsia, odds ratio 4.3, so very high, small gestational age 2.9, postpartum hemorrhage 2.9. And you know, this meta-analysis is from 2021. But since then, several studies are now appearing in the literature. I try to combine them. It's not meta-analysis, it's just summary of all this evidence. I would like to underline only two aspects. First, the placenta previa, but what's not described in the previous meta-analysis because there was only one study reporting on this outcome, and as you can see, all three studies studying this outcome show the statistical significant association. And this is logic because one can think to the uterine peristalsis that somehow disrupt the site of implantation. And then if you focus to the three the largest studies, they all tend to confirm the association with preterm birth, preeclampsia, small for gestational age, postpartum hemorrhage. So I think that the literature is really concord on the increased risk of obstetrical complications. So what are my conclusions? Well, first, I think that adenomyosis does not have a main detrimental effect on embryo implantation, at least in non-severe cases. Okay, because the studies that I showed, according to me, included only few cases that were really severe. And second, however, adenomyosis may disrupt the process of implantation, leading to an increased risk of obstetrics complications. So we have to broaden our view. So we know that there is receptivity of an embryo, there is selectivity, so the capacity of the endometrium to select the bad embryo and stop it soon before it develops. And then there is the plasticity, therefore the capacity of the uterus to adapt to this growing placenta and embryo and to allow an optimal development up to delivery. And probably adenomyosis is more detrimental there. It renders the uterine, the endometrium less able to select the embryos and somehow disrupt its capacity to adapt for allowing a normal pregnancy. I thank you for your attention.
Have some 10 minutes for questions.
Yes.
Edgardo, so thanks for your great talk. Just a question, so at the end, if you have a patient, Edgardo is one of the leading of IVF center in Italy, and his center does guidelines in Italy. So basically, if you have a lady with adenomyosis and you have to transfer an embryo, so do you pre-treat this lady or not, according to the evidence, for adenomyosis? Adenomyosis of inner myometrium, diffuse adenomyosis, not going hysteroscopy for surgery, diffuse adenomyosis, before the first transfer, and you have a good embryo, what are you going to do?
That's, you know, a long discussion that we have with Katerina every time we talk about adenomyosis. I have to say that I'm a really bad sonographer, and in general, I don't look for adenomyosis. Well, I'm joking, but more or less it's like that because, you know, we are still discussing about the detrimental effect of adenomyosis. So we are still discussing what is the effect, what is the form of adenomyosis that can disrupt. And it's really strange that in such cultural situation, we are already thinking to therapies. We do not yet know the problem. We do not know what to treat. And so for me, in that situation that you told me, adenomyosis does not exist. 1, 2.
That's a long discussion.